to us about the culture of innovation and exactly what that means and how you can affect it.
So what's interesting about innovation is innovation means so many different things to different groups, organizations, people, right? At UPMC, we have a specific approach that we're taking, primarily around value-based healthcare and propagating all of what we have today to invent the future of healthcare. But innovation is also about process innovation. Innovation happens at the clinical level, at the quality level, at the patient level, right? The design thinking level. There are multiple instances of innovation happening across the institution. What's really interesting about innovation, and something that we as an industry, I think, have to contemplate, is that there inherently is what I call a culture clash that exists in innovation. And most of us don't realize that this actually exists, and we're just trotting along and trying to push innovation through, the square peg and the round hole thing, right? But I think if we recognize the fact that there is this inherent culture clash, clinicians are taught to go with the tried and tested, evidence-based guidelines, best practices, clinical protocols. If it's worked before, do more of it, is what we're taught. Right? And then comes the innovators, the entrepreneurs, the startups, right? And we're saying, hey, here's this brand new software, brand new methodology, trust us, it'll work. So this clash happens for a reason, okay? So I think the way to go about doing this, and this is what we're doing at UPMC and at UPMC Enterprises, is first to acknowledge that there is this culture clash, and secondly, to leverage it, to pivot it, to turn it around on its head by essentially engaging the end users, the clinicians, the patients, in the design of the solutions, design thinking, right? So how do we make sure that before the first line of code is written, before the solution is deployed, right, we actually have these clinicians and these patients and whoever the end users might be truly engaged, even at the strategy level, right? So that's what we're doing. And because if you have them engaged up front, right, you have them empowered, you have them leaning in as opposed to their hands, across their chest, right? And I think that's a really critical aspect of the culture of innovation. And there's obviously a lot more, but that culture clash is something that we really need to nail.
So when you talk about engaging the patients and engaging the physicians, exactly what does that mean? How do you engage them to innovate?
So I'll give you a specific example. We're working to push ahead with a number of different innovations at UPMC. Specifically at UPMC Enterprises, we're working hand in hand with what I call the living lab that is UPMC. So the payer provider organization that is UPMC. We're a 25 hospital group, right? 15 billion dollar healthcare organization, 62,000 employees. 3,800 physicians on the provider side, and on the payer side, upwards of about 3.1 million members. So that's the living lab, right? So when we're engaging our end users, before we decide to embark on any project on the innovation side, we're not making a decision on our own, right? We're reaching out to these subject matter experts because they're the experts on the ground. My clinical colleagues, the nurses, the operational folks, the IT colleagues that I have across the organization. And we're together vetting these opportunities. And if there is a strong clinical and or an operational champion or a set of champions and a set of business cases to really push this forward, then we embark on that journey together. Right? So it's this level of co-creation that we have, where we start with empathy, right? We're going down together at the level of connecting and understanding and really feeling the pain points, but then putting together a sensible trajectory to leverage newer technologies or newer methodologies or existing technologies and methodologies, because innovation isn't always about creating new things, right? But really rethinking the paradigm and rethinking how we define healthcare, let alone how we implement healthcare.
All of that makes a lot of sense. From a physician point of view, I get it. How do you engage patients? That same process, but from the patient perspective, not just the clinician.
Yeah, so I think it's really important for us to engage patients throughout the entire process, right? patient-centered care just rolls off our tongue. You ask any clinician anywhere if they're patient-centered. Hey, do you practice patient-centered care? They'll say, of course we do.
Naturally.
Yeah, I treat a patient. That's patient-centered care.
Right.
And they actually mean it, right? They're not wrong about it in the sense that they care for the patient. They want to do what's in the best interest of the patient.
Yeah.
But what's happening today is that the technological barriers that we've erected around that workflow, right, prevents the clinicians from doing all of the things that the clinician actually needs to do to take care of the patient in a patient-centric way, right? So while patient-centered care rolls off our tongues, it's not actually built into the very applications that we're going live with, that we're using, right? So the principles of design thinking and human-centered design really push us for that pivot, where we're saying, hey, if we can leverage the patients, if we can engage them in the design of the solutions, but also recraft the entire workflow around them. So I'll give you one specific quick example,
Please.
right? So I was at a conference some time back. This was an imaging conference, and I was talking at the opening keynote about patient-centered care, and I actually brought a patient to the stage. It was amazing. It was quite amazing in the sense that I was able to, with the patient, really convey a story that I think everyone needed to hear, which is that when we innovate, as we're innovating today, when we implement, as we're implementing today, and when we deploy, and we're engaging, and we're doing all of the things that we do in healthcare today, we're doing things with the best of our abilities, okay? So for this patient, she had gone through this journey, okay? And it was, without going into the details, it was a trying, testing journey, because when patients come to us, it's usually at the worst times of their lives,
Yeah, right.
is when they're engaging in healthcare.
It's an unsought service.
Exactly. By today's definition of healthcare, that's when they engage,
Right.
right? So she went through, months worth of trials and tribulations, finally came to some sort of a decision to go ahead and get a scan, and she was struggling with getting the right levels of consults with the expert radiologist, with the pediatrician, and with all of the care team around the patient. But by today's standards, we did everything perfectly for that patient. The scheduling, the appointment for the patient experience by the way that we measure it today, the scanning itself, the protocoling, the contrast that was used, the report turnaround time, the follow-throughs, the appointments that happened after, everything happened perfectly, right? But by the patient standards, oh my goodness, it was horrendous. It was the most trying times in my lives, and if only I could have spoken to that specialist, if only I knew who the radiologist was, if only this, if only that, right? So that's what I mean, is we've designed solutions to do the things that we want for the solutions to do, and it's doing it perfectly, okay? But what we need to do is really rethink this entire paradigm and challenge the status quo.
So is that achieved mainly through observational research, or is it quantitative and qualitative research of patients specifically? How do you achieve it?
So I think it's all of the above, right? But it's also specifically going about it intelligently, in the sense that you're not just going down and interviewing patients, when it's great. I love the principles of design thinking and all of that. But it's also saying, all right, how do we make sure that from a vision to execution perspective, we're leveraging technology in the most optimal way, right? How do we make sure that we're designing solutions for joy, not for regulations, not just for documentation and billing, but really for joy? How do we design solutions for empowerment, right? Where we're empowering patients to take charge of their journey that they're embarking on. Empower clinicians to do more of what clinicians need to be doing, right? It's really all of that. So it's more than just obviously interviews and sitting down and making, having these observational studies, which is absolutely critical. But I think that's where we are as an industry in healthcare. It's this perfect crux of all of these needs and capabilities around technologies like artificial intelligence and machine learning, maturity that we've had in the industry of what not to do or what to do more of, right? That's really coming together. So if only we can capitalize that perfect storm of opportunities and capabilities, I think we'll be much better off.
Yeah. That makes a lot of sense. Talk to me about the joy that you just referred to, designing for joy. That's a really intriguing phrase.
Yeah.
What in the world do you mean?
So when was the last time that you had a physician go in and say, oh, next week is my go live for EMR X or Clinical Information System Y, you
Right.
know. I'm so joyous. Never, right? Never happens. It's not their fault. It's not the fault of IT. It's not the fault of the innovation folks. It's just where we are as an industry, all right? And we've made tremendous progress in the last 10, 20 years, going from analog to digital and deploying solutions. And we've had efficiencies galore in a number of different things, all right? But the solutions that we've generated today were purposefully designed to replicate the analog culture that we had when we had our charts and our films and our slides.
But yeah.
Right? So what we've ended up with is the digital view box for radiology. I'm a radiologist by background, right? We've ended up in the EMRs with folders and files. I'm pointing out to the terminology that we're using today
Right.
in our digital environment. We're
Yeah.
still calling it folders and files and tabs, right?
You're right.
Right.
It never occurred to me. You're right.
Radiologists hang their studies. We don't hang anything anymore. We don't provide a wet read. We still call it a wet read. It's not wet anymore. We're not hanging films. It's not even a film anymore. All right, so we're really hanging on very tightly, embracing this culture, this definition of analog. And we've digitized it. So what I'm saying is, I think enough with doing digital. That's what we've been doing for the last 10, 20 years.
Right.
How do we stop doing digital and be digital?
Huh.
So there's a difference to doing digital and being digital. And I think that's what we need to go towards is being digital, thinking digitally, representing data and insights differently so that we're able to consume mass troves of insights meaningfully, contextually, in a way that makes our lives easier, that brings perhaps joy back to the very practice of healthcare.
That was almost poetic. That's great. I
Thanks.
love that mind frame. One more question for you.
Yep.
How do you prioritize? There are too many things to work on, too many innovations to implement, too many new ideas coming in. How do you prioritize?
I think prioritization is absolutely critical. You can't do everything, right? As lofty of ambitions as we might have in both of our organizations. I think it boils down to really focusing on the inside of who you are as an organization and who you want to be as an organization, right? Creating a strategic framework that gets you from point A to point Z, right? And having the right the right sets of talent and enablement, right? With support, top down and bottom up, right? So I think that's really important. I think that's when you then start prioritizing. That's when you start saying, all right, we're delegating to specific teams the things that these teams need to be doing across the board, right? You can't be rolling out EMR systems and PACS systems and VNA solutions and patient-centric apps and all of that, and also at the same time be doing what we're talking about here. We can, however, do it together if there are specific pockets of focus across the organization that's coordinated, that's aligned to that strategic framework that I just described.
And so what is that common thread, that theme that everything relates to?
I think the common theme and the thread really is, first and foremost, a desire to challenge the status quo, right? It's a hunger for us to say, hey, here's where we are, and we're not poo-pooing the past, we're learning from the past. All of the successes and the failures that we've had in the past, let's build on that, but really then push towards not just incremental innovation, but transformative innovation that's really, changing the very face of healthcare. And so I think when you have that thirst and that desire, and then you allow for that culture to propagate itself and allow for questions, hard questions to be asked, allow and create a culture of where people are able to raise their hands and call shit when it happens. that's what we need to be doing more of, right? It's that level of passion that you need to tap into, but it's also a level of I think a top-down as well as a bottom-up series of passionate individuals that you need to pull together to allow for this to happen.
Rasu, that was awesome. That was great. Thank you so much for your time. Anything else we want to chat about?